It looks like I'll be talking about osteoarthritis, but I'm actually going to be talking about exercise is medicine and knowledge is power. What do gray hair, wrinkles, osteoporosis, and osteoarthritis have in common? Well, they're all evidence of cell fatigue, or more academically termed, they're evidence of age-related loss in the ability of cells to maintain homeostasis. Sounds better. But really, while the first three are related to aging, osteoarthritis is only aging predisposes people to osteoarthritis. Not everybody obviously gets osteoarthritis. So let's look a little bit at the multifactorial causes of osteoarthritis. We have changes outside the joint that the aging changes affect joint function. We call those outside the bone. And then there are aging changes that affect joint tissues. We call those changes out within the joint. And then we have other factors that people have coined risk factors, or we just call them other factors, that will eventually take this susceptibility to osteoarthritis and make it happen. The question is, of course, how can we affect some of these age-related changes before they even happen? That would be good, because then we decrease the susceptibility. Let's look at sarcopenia. Sarcopenia is the age-related loss of muscle tissue. We can exercise. We can do resistance exercises that help to delay this muscle going away associated with aging. Exercise, number one. Loss of proprioception and balance. Exercise, you guessed it, there are exercises for proprioception and then there are exercises for balance. Increased joint laxity, which are all changes associated with aging. Again, exercises. How about loss of normal bone structure, osteoporosis or osteopenia? Of course, weight-bearing, load-bearing exercises will delay this osteopenia. Increased stiffness of ligaments and tendons, you guessed it, exercise. And then in the other factors, obesity, exercise, endurance exercise, strengthening exercise, all this will hopefully get rid of too much weight. And joint injury is similar to increased joint laxity, again, exercise. And question is, can we actually do something to the actual cartilage tissue? Let me tell you a little bit about cartilage tissue. The chondrocytes are in charge. They live and they produce the extracellular matrix. They produce type 2 collagen fibers. They give the structure to cartilage, and they produce proteoglycans. They make sure that the water is imbibed and stays within the cartilage structure. There's a delicate balance between anabolic and catabolic activities. Happily ever after. However, something triggers the expression of catabolic enzymes, and all of a sudden, the balance is no longer there, and it leads to a net loss of cartilage tissue. The chondrocytes work hard. They want to keep the cartilage going, so because they have to work so hard, they now produce type 1 collagen, and they produce cheap proteoglycans. Proteoglycans that can't imbibe as much water, and they don't work very well with the type 1 collagen fibers. So as a result, the chondrocytes fatigue. They can no longer work enough to get the cartilage back to normal. Cell death happens, and they produce inflammatory mediators together with the synovium, which are catabolic. The cartilage tissue flakes off, it becomes dry, and we call those joint mice within the joint space. The cartilage finally erodes until the bone is exposed. It's very painful. There is now a smaller distance between the joint partners, and there's more motion. The bone thinks there's more motion, we need to stabilize, so they build osteophytes. And we have full-blown osteoarthritis. Now, of course, the question is, what can we do to not have these things happen? Would exercise help? And yes, of course, you guessed it. Exercise can delay osteoarthritis on a molecular level, which is fabulous. Look at the drawing on the right. In normal cartilage, we have a steady state. We have forces acting on the cartilage whenever we run, walk, even sit. There are some forces acting on the cartilage. This gets transferred into something that is called mechanotransduction. The mechanical forces get changed into chemical activity, such as gene expression. So there's stuff happening because we weight bear, we load our joints. So mechanotransduction improves extracellular matrix because all of a sudden it changes what type of collagen is being produced. It inhibits the cell death that we saw happens earlier, and it inhibits inflammatory responses, which we learned was catabolic. So the best advice we can give to people with osteoarthritis is exercise. We can change exercise. Exercise changes things outside the joint, within the joint, and within the molecular level. We can do range of motion exercises, stretching that maintains the available range for the joint. We can do endurance exercises, not just for cardiovascular benefits, but also to tell the body it's okay to move. We can do strengthening exercises, mostly because of load bearing that comes with, strengthening exercises, because each time a tendon pulls on a bone, this is considered load bearing on the bone and therefore also on the cartilage. Balance and proprioception exercises, also a good way to keep the cartilage going. We also need to educate our patients. We need to let them know exercise is good. So many people and providers, by the way, think that exercise could be detrimental to the intervertebral disc, to the bones, and to the cartilage. We need to let them know it's good for you. And we need to promote self-efficacy. We need to let the patients know you're in charge. If you don't need to take medication each time you have a flare-up of pain. If it's, of course, really bad, you do. But there are stages of pain. Try walking around. Try an exercise. Try something else. You're in charge. That's considered self-efficacy. There is a perfect amount of exercise, we believe, that is perfect for cartilage or for bone or for the intervertebral disc for that matter. And sometimes this is referred to as the Goldilocks zone for mechanical stimulus. If you look at the left down here where the frequency is, standing is 0 frequency. That's not good enough. Slow walking is also not good enough. We need to have a certain amount of frequency, like a brisk walk, to have a beneficial impact on cartilage. We also have to worry about load bearing. We should at least have half the body weight and at the most 8 times the body weight that we use to load bear in order to have this beneficial effect of exercise. In conclusion, the course of osteoarthritis can be influenced by exercise. Exercise is medicine. As we learned, it affects age-related changes outside the joint, within the joint, and risk factors. And of course, it can even help on the molecular level. Osteoarthritis can be influenced by education. Knowledge is power. Empower your patients to know that they're in charge. People with osteoarthritis who are confident in their ability to reduce pain without extra medication are more likely to stay active longer. Thank you.